Hello, everybody. Okay, we're going to go ahead and get started now. Okay, so hello and welcome. My name is Angela Tai, and I am the project coordinator with Faces for the Future Coalition. For those of you who were not able to make it to our first webinar, I'd just like to do a quick introduction. Faces for the Future is a national nonprofit organization that connects high school students with internships in the healthcare field. One of our goals is to bring more underrepresented cultures, ethnicities, and backgrounds into the health professions. And in addition to exposing our students and alumni to the clinical side of healthcare, we also want to give them more information about careers in behavioral health, public health, and also through this webinar series, global health. Today, we are partnering with Global Health Fellows Program 2, a program that helps diversify the global health field through their fellowship program with USAID. Just a few logistical things before we get started. If you have any questions throughout the webinar, please use the question feature on the GoToWebinar platform. We'll be keeping track of all of your questions, and throughout this hour, then answer as many as we can through our Q&A session. Okay. And just to give you a quick overview of what you can expect out of today's webinar, we're first going to introduce our amazing guest speaker today. Then we'll go into key stepping stones. Then we'll go deeper about those. And then we'll end with our Q&A session and then our conclusion. So I'll now be introducing our global health expert for today's presentation, Josie Ramos.
Hi, everyone. It's very nice to be here. I will start off by a disclaimer, which is I have never done a webinar before. So I hope I'm able to answer all of your questions and have a great conversation, especially at the end. So a little about myself. I'm the senior program manager at Rise Up. Rise Up is a program here at the Public Health Institute, and we work with leaders all around the world in Central America, Honduras, Nicaragua, El Salvador, Mexico, Belize, and in Africa and Malawi, Liberia, and Pakistan, India, all over the world. We work with leaders who are doing amazing work in sexual and reproductive health work, in maternal mortality, so trying to prevent women from dying in childbirth and children from dying early. And we also work with youth who are working with other youth, so young girls as young as 9 and 10, who are working to prevent early marriage, prevent early childbirth, teen pregnancy, and other issues around sexual and reproductive health. We also work in non-communicable diseases, so preventing diseases like diabetes and heart disease, in all of the places where I mentioned. So I've been at the Public Health Institute for 15 years now. I'll start it off. I'm a great example of someone who just stumbled into public health and global health. Tell you a little bit about myself personally. I grew up in LA. My mom is a Mexican immigrant. She immigrated to the U.S. to marry my dad, who is also Mexican, but from the state of New Mexico, so he was a U.S. citizen. I grew up speaking only in Spanish to my mom and only in English and some Spanish to my dad. So I grew up bilingual, always, and neither of my parents graduated from high school, much less college. They really saw education as a means to an end of making a good living. So they saw it as a professional development, not so much as something to love, passion. So I was always a good student. I loved to read, and I loved especially reading novels and stories, and always was a good student in high school. In high school, my father passed away when I was 16, and that made things very difficult financially for my family. I have a younger sister, and she and I ended up having to get jobs and work part-time in order to support our family. And so on top of needing to stay in school and get good grades and do a lot of the extracurricular activities that I was doing, I was also working. And I had never really thought about college or studying. I really thought, oh, I'll just go to the community college down the street. And that's what was affordable for me, and that was what was possible. And I I'm sorry, I'm going to get a little emotional. I'm really indebted to my high school teachers who really who really saw something in me. And that's what makes me so excited about being part of this program, is that you guys have that right now with FACES, is that you have that mentoring and you have someone taking an interest in you and saying, you know, you can do this. Think big. And so, I applied to colleges only because they told me to. And I applied and got in. The only way I was going to go to college was on a full scholarship, and so I was able to do that. And I went to Stanford for 4 years and really struggled there. I thought I was going to major pre-med, and quickly realized that that just wasn't the route for me, and decided to double major in English and Spanish, which was two things that I knew very well and that I loved. And so I did that and thought, okay, I'll be a professor in college. And I thought that that was my path. And I went to graduate school right out of college, started a PhD in literature, and was never really fully like, this is it, this is what I want to do. And I kept volunteering for different organizations for violence prevention, tutoring programs, things that kept me, that I was passionate about, things that kept me in touch with people and learning and helping people, and that service piece that I felt like I was missing in a university setting. And so I was always doing that, and one year I was lucky enough to go with a friend of mine to Mexico and help her interview women in southern Mexico, indigenous women in the Zapatista movement in Mexico. And we interviewed them, and I was translating for her. And the women all said, and I was astounded, they all said, you know, the one thing that we need to improve on in our movement and as women is our access to sexual and reproductive health. So access to family planning, access to health services in their language, in their indigenous language. And I came back from that trip and I thought, God, wouldn't it be awesome to be able to work in Mexico, work with women like that? And there's this need in sexual and reproductive health, and wouldn't that be amazing? And I was luckily able to end up here, and I'll tell you a lot more about my work here as we move on.
Sorry, really quick. Just want to make sure everybody can hear us. If somebody can't hear us, can you go ahead and use the question or chat feature and let us know? I apologize for the technical difficulties. Okay, some people can hear. Okay,
thank you. Well,
sorry about that. We'll go ahead and continue. Okay. Sorry, Josie, anything else you wanted to
No,
add?
I was good.
Okay. Thank you again, Josie, for sharing that. It's definitely super helpful to hear about not only her background going into global health, but her personal background and why she chose this field. One thing to note about Josie is not only does she have the perspective of somebody who is currently in the global health field, but she is also an employer in the field. So feel free to ask any questions that you have. Okay, so we're going to go into your stepping stones. These two pieces are identified by GHFP2 for a successful path towards the global health field. One is education, and then two is overseas experiences. We'll go deeper into those key steps. So we're going to begin with education, which is a very important step. When you pursue your bachelor's degree, there are some common questions that you might have. So what education requirements are there? What other opportunities are you doing outside of the classroom, for example, internships or volunteering? And aside from emphasizing what you need to do, aside from emphasizing that you need to go to college to pursue this field, there are some things we found that some people may assume in regards to education. So here, you need to major in biology, nutrition, or public health to pursue a career in the global health field. Now, these are very popular choices for pursuing this field. However, it's important to note that there are many, many other specialties that you can choose from. For example, human resources, social work, public policy, international business, engineering. The global health field calls for a huge range of people with all types of different skill sets. Also to note, these slides will be sent out, and this whole webinar will be recorded and sent out to those who are participating and also not participating. So going back to the presentation, piggybacking off that last slide, some people might think that global health is just entirely about becoming a nurse or a doctor that travels abroad to do work. While this is part of the global health field, there are a lot of other key roles that play a huge part. In our next webinar series, Global Health Pathways, Your Options, we'll be talking a lot more in depth about these different career paths. So I'm now going to pass the mic again to our panelist, Josie, to comment further on tips around education.
Thank you. Well, the biggest thing that I have to say around education is it really, truly is a wide open field. We've hired people who work with us who majored in sociology, anthropology, history. So it really isn't all about, and then we have the people who majored in international development, who majored in public policy. So we have a mixture of the two, for sure. But really, I think the important thing is pursuing an area of study that you're passionate about. And for me, for example, I double majored in English and Spanish, and that was what interested me, and I use that every day. I use the storytelling and the literature background every day when I do curriculum development, for example, for our programs. Or I do a training with girls and helping them how to tell their story to advocate with decision makers to change the laws and policies around early marriage, for example, in Malawi. So those skills are applicable. What education gives you really is a critical thinking lens, I feel like, and an opportunity to learn to write really well. Those are the two things that you get from education. Really what matters most are the experiences outside of the classroom. So when we hire, for example, we look for people who have lived in other countries, worked significant amount of time in other countries, have traveled extensively, who know what it's like, who know what the reality of working in another country is like. And can use that knowledge of what it's like to do a program on the ground here with us to implement our programming. And that is what is most important. And that's difficult to find. Often we have really good candidates who have studied all the right things and done all the right stuff and have great grades and don't have any overseas experience, any travel experience, and we just can't hire them because that learning curve is really hard you can't hit the ground running, as they say, in global health without having some kind of knowledge around the traveling and doing work overseas. So
Thank you again, Josie. So just kind of transitioning from what she just mentioned, we are going into the importance of going overseas, actually. Here are, again, some common questions that get asked about this component to a global health pathway. So why do I need to get overseas experience? What's so important about it? What if I can't travel abroad? So to answer those questions, we posed this question to Josie. What lessons did you learn overseas that you wouldn't have been able to learn just from doing local or domestic work?
I'll give you some experiences because a lot of what I do in my job, especially most recently, is curriculum development. So I sit here in my office in Oakland and develop a training program for girls in Liberia. So I developed like a 6-month training program for them. And I have to know what the reality is in Liberia, or even if it's not Liberia, in a country like Liberia, in order for me to design an effective training program. I need to know that, the literacy rate is going to be very low. I need to know that probably the training space that they're going to be in doesn't have any walls. So I can't be designing, flip charts to put up on a training wall that doesn't exist. I need to know what the cultural framework is for their lives in Liberia. So, for example, when we talk about public speaking, I need to know what that looks like, for what the norms are. And I need to be able to do the research to give them an example of a good public speaker that fits that context. So I'm not going to give them an example, for example, of, Bill Gates speaking. I'm going to look for an example of someone like Amina Mohammed, who actually just got named today U.S. Secretary General, and who's Nigerian, and who, even if she isn't Liberian, sounds like them and looks like them. So having that cultural competency is really what traveling and being able to imagine the places in which the program is going to be implemented and what it's going to look like. Nothing gives you that experience except going there and being there and meeting the people and talking to them and seeing what the reality is like on the ground. And a lot of times we talk about theory, and that's what education gives you, right? Is the theory of what a training curriculum should look like and what you should do first, second, third, what the pedagogy is around it, like how people learn and how you develop ideas and all of that. And what traveling gives you is that insight into, we need to be adaptable. The theory needs to adapt to the reality. So for example, talking with girls in Liberia or in Malawi or in Nigeria, where girls are really silenced and married off early at 10, 11, 12 years old. We need to understand that before we go in and say, oh yeah, girls empowerment, yay, girls can do anything, with this kind of American can-do, attitude, and try and apply it in a place where culturally that's not going to go anywhere with the people that we're talking to there.
Thank you again, Josie. So one more question. Aside from gaining certain valuable lessons from what is something you would say about the expectations versus the reality of global health work? And can you share a story?
Of course. So I think one of the things that, one of the myths is that, oh, it's so glamorous. I tell people, oh, I work in global health, and they're like, wow, you get to travel. Isn't that amazing? And it is amazing. There's no doubt about that. But it's not glamorous. It often means 10, 12, 14-hour work days when I'm traveling. It means traveling not in the best, not staying in the foofy hotels and going out into the field. And I think the other misconception is that, you're there because you want to help people. You're going to make a difference and save people and save people's lives. And while it may be true that, we have a positive impact on people's lives, I'm not denying that. I think the attitude that we somehow know better or know best, actually it's the other way around. When I go to another country, I'm there to learn and to see and learn about the realities that women and girls and young people live in those countries, and that looks really different from my reality. And so having that humility to say, I don't know, and having that cultural competency to not make assumptions and to ask questions and to just be willing and open to learn, I think that's the most important thing around that as global health professionals we have to offer.
And then also from an employer's perspective, going overseas is also a very valued point on somebody's resume. Josie also, she touched on this earlier, but being an employer of the global health field, do you have any additional comments in regards to that?
Well, when we hire, we often look for two things. One is, like Angela just said, the travel experience, the work experience in other countries. And sometimes the country matters, and sometimes it doesn't. Just the fact that someone has, we don't work in Paraguay or Peru, but if someone has done Peace Corps there, that is a huge benefit. And I know that I think it was Brooke touched on Peace Corps in the last seminar. So that is a great experience. So it doesn't have to be that, well, we're working in Liberia, so you have to have experience working in Liberia. You could have experience working in Uganda or India, and we would take that into account. And the other piece is being bilingual or bicultural, which is a huge thing that we look for. Our programs in Central America are all in Spanish. And so we need someone who's not just conversational in Spanish, but who's actually bilingual. And that's hard to find. We struggle to find people who are bilingual in Spanish, and we're not talking about a difficult, a small language group like Swahili or something. We're talking about Spanish that is in California. We thought, oh, that shouldn't be so hard, but it is. And I don't know why. I can tell you some of my theories why later on, but that's a big thing that we look for. And being bicultural gives people insight, I think, even if you're not bicultural in the culture that you're working with. So, for example, when I'm bicultural in as a Mexican, American, Latina woman, and when I go to Africa, even if I'm not, from Liberia, having that perspective makes me open and understand and be more empathetic to cultural issues that come up when I'm working there or wherever I'm working. So that's another piece that is really important and that we look for when we hire people.
Okay, so we are now going to move into a very important piece of this webinar. Many employers in the global health field, including GHFP2, recognize that there are certain barriers that people from underserved backgrounds face, what they might face. And I just want to take a minute and talk about what I mean when I say underserved. I mean that there are certain systems that are in place for example, the school system or the hospital system, that are not serving certain communities how they're meant to. For example, when I was in college, I hesitated about studying abroad in another country because I was thinking about, well, who's going to help take care of my little sister back home, and how am I going to pay for this? And I'm already working 2 jobs at school to get through it. And what would my family say if I said I was going to leave the country? So we're going to go deeper into these barriers and talk about how to work through them. I'm going to pass the mic again over to our panelist, Josie, and ask her the question. Many young professionals believe that the global health field is out of their reach due to family responsibilities or financial constraints. Have you experienced this as a barrier, and how did you address it?
Mm-hmm. Yeah, well, definitely, it can be a barrier for sure. It is expensive to travel. But there are definite avenues to be able to do it if you really want to do it. One of them that I think is a huge advantage that so many people have that are listening in on this webinar is that you're students. And as a student, you can apply for scholarships, for funding in ways that other people who are not, or who are in between being an undergrad or a grad, or a high school and an undergrad, have a much harder time finding funding to do that. So internships and paid and unpaid internships. So for example, we've had several interns who have been with us for the summer and have been volunteering. And so we're not able to pay them, but we can use the miles on our credit card to fly them to Malawi to be with us for training, for example. So working something out like that with your organization that you're interning with, or a program that you're interning with, is definitely something that you could negotiate from the onset of your internship. Another way is to just apply for funding for traveling, for studying abroad, and working in also some and staying longer in the country or during your studies to be able to do volunteering with local organizations. And a good way to identify that is just to ask people and to be persistent. So even if you're only studying, you were able to get funding and support to study abroad for 3 months, but in those 3 months, you're able to volunteer at a small organization in some capacity. That counts, and that's a good stepping stone towards getting that experience of working in another country and living there. So to find funding and just be persistent. I think asking your professors, your teachers, your mentors, for names and contacts of other people who might be able to hook you up with a local organization where you could volunteer while you're studying, for example, or getting that contact information and then following up, and not following up just with 1 email, but maybe it'll take 2 emails or 3. I just had someone contact me for the 3rd time, and it was always on my to-do list, but it was flagged, and I just never, things come up, and it's something that I want to do. I'll call her back and talk to her. And it wasn't until she emailed me a 3rd time that I was like, okay, I need to do this. I'm going to do it right now. And she gave me her phone number in the email, and I just called her right then. So I think being persistent and not giving up on that, if you want to do it, you can do
it. So this slide is a quote from GHSP2. USAID's Bureau for Global Health has found diversity is crucial because it creates a workforce that is adaptable, resilient, culturally competent, and better able to respond to the complex and changing needs in global health. This is essentially stating how important diversity is. And when I say diversity, it means in every sense, from race, religion, class, income level, sexual orientation, etc. That diversity is important because it brings people that are adaptable, resilient, culture competent, and better able to respond. So moving forward, because GHFP recognizes that this is the type of workforce that they want, they created an amazing resource guide to try and address the top 3 barriers that they found, barriers towards overseas experiences. This resource guide will be shared after the presentation. So they're the big 3 F's: family, fear, and funding. And we're going to take some time to go into each one. So starting with family concerns, it can be very hard talking with your family and friends about the need for global health work. And this is especially true for those who are underrepresented in global health. A recent study showed that among minority families, there is a fear for children traveling into the unknown, especially for first-generation college students. Even the thought of going away from home to college can frighten their families, right? And this issue can be addressed by giving a clear understanding of the security and logistics and preparation for overseas work. This will also call for a lot of reflection on your part and figuring out why you're interested in going overseas and how does this experience fit in with your long-term goals. Once you are able to confidently answer these questions, then you'll be able to communicate this clearly with your family and your friends. I'm going to pass this again to Josie and ask her if she has any personal experiences with this specific barrier.
Man, do I. I think the family concerns, I think what Angela just said about even going to college is a huge thing. It's a good example. My mother never, ever, she was a typical very protective, overprotective, I would say, parent, and I never spent a single night away from my house until I went on a college visit after I had gotten accepted to Stanford. And I went, and she made me take my sister with me, my younger sister, because she's like, oh no, you're not going by yourself. And my sister couldn't even believe it. I remember she looked at me on the plane and she's like, are we really doing this? Like, are we really going, by ourselves? So I know that's a huge barrier. And it is scary, and we'll talk about fear later. But I think that, I think talking to family, and for my mom, whenever I travel, I have to tell her, okay, I'm going to Honduras. Well, who are you going to be with? I mean, it's still, I'm 44 now, and she still's like, well, who are you going to be with? And who do you know there? Well, I'm going to go with this person, and I'm meeting them, and are they meeting you at the airport? Yes. But we're going to be traveling around, so I try and call her when I'm there. And stay in communication when I'm there, and that's a huge thing to be able to let your family know, yes, I will be able to stay in communication, or no, I'm not going to be in communication, but I'll try and call you as soon as I get there, or whatever it is that will make them feel better. And to be able to share a plan and an itinerary with them and say, okay, I'm going to be landing here, someone's picking me up, I'm going to be in this city for these many days, and then I'm going to travel, and to share the information, because I think that piece of not knowing is huge. And also I think for my mom, being a Mexican immigrant, and I think this is my own personal theory of why this is a barrier sometimes, as a Mexican immigrant, my mother, when I told her, I was going to Mexico that first time to interview Zapatista women in southern Mexico, she's like, why are you going there? Like, why would you want to go there? Because she knows the harsh reality that women live in Mexico. And she's like, why are you going there? It's dangerous. It's, there's a lot of poverty. It's difficult. It's difficult to get around. You have to be on this bus for hours. And so she knows all too well, and a lot of our families, our parents and grandparents know all too well the hardships that people experience in developing countries. And so I think that that's one of the barriers where they're like, why do you want to go experience all of those hardships? We came to this country so that you wouldn't have to. And so I think that is a barrier as well. So trying to explain that to them and just really talking to them and giving them a lot of information about where you're going, what you're doing. And most of it for my mom was she saw that it was fulfilling to me, that after the trip I came back and I was excited and happy, and I was able to tell her what I did and what I saw, and that made a huge difference in terms of getting her on board.
Thank you for sharing your personal story. I think we can all really relate to that. So the next one is fear of travel and also fear of the unknown. It can be especially true for those who have never traveled outside of the U.S., even just outside of California. And to address this, on the slide, there are important questions to get answers to in order to reassure yourself that you will be taken care of while you're traveling abroad. So there are some basic questions like, where am I going? So that requires some research on the country. What is my program doing? So what type of work will you be doing? What's going to be asked of you? Stuff around your passport. Do you need to get a visa for that country? How much are flights? How will you access your money? So how are you going to set up a bank out there? How will you contact people locally and internationally? Just like what Josie mentioned, especially if you have very worrisome parents, how are you going to set up a cell phone or email or internet access? The next piece is health and security, which is a huge one too. Certain countries require vaccines. Do you have international coverage through your health insurance? Are there any travel alerts? There's a whole page on certain countries that the U.S. government might put out warnings against. Also, and then packing. Is there anything you need to pack specifically? Important documents like passport and other forms of identification. Josie, do you have anything else to add for this specific barrier?
Yeah. Never let your parents read the security travel alerts because they sound horrible. I read them sometimes and I'm like, really? Because I travel to Guatemala and Honduras a lot, and I feel very comfortable there, and maybe it's because I speak the language and I've been doing it for a long time, but if you just read the travel security alerts and that's your context for the country, it says, Honduras is the most dangerous country in the entire world, and the murder rate per capita is the highest in the whole world. So you don't want your parents to be reading those. You can read them and just know that it's scary to read. What you really have to know and you really have to develop when you're traveling are the personal connections. So, for example, a colleague of mine traveled to Honduras. She was arriving after me, and I was already there. And I said, have you been to Honduras? She speaks Spanish. It was her first time traveling to Honduras, and she's like, no, I've never been there. I said, oh, okay. Well, let me call someone who can go pick you up at the airport. So I did, and I put them in touch with each other over email, and this person, my friend, was able to go and get her, and they were, they made that connection and had lunch, and during that lunch, my friend was like, oh, where are you staying? Oh, that hotel, it's not so great. Here, you might want to think about moving to this hotel that's better. And so getting that knowledge of people who live there and work there is really important. And getting in touch with people like me who work in those places, and who, even if I can't pick you up at the airport or tell you which hotel is good or whatever, so I know someone who can, or I can put you in touch with someone who can. And so that personal connection of on the ground, and having a network of people, like I never leave the country without all my contacts in my phone, and having backed up my phone, and having left a copy of my passport here so that if I lose it, I have an easier time getting it. So planning is a huge piece also of planning the logistics, and the more you travel, the better you're going to get at planning and packing. And it's important to know what, like you said, vaccines and stuff, and packing repellent really strong repellent, not like nice off from CVS, but like deep repellent, depending on where you're traveling, and knowing, when the rainy season is. I mean, that kind of detailed planning is what you need to do, and there are all kinds of resources to help you do that.
Just wanting to extend the slide a little bit more. I've also heard that kind of fear, it never goes away sometimes. And so do you mind me asking then, do you find that fear has gone away because you traveled so much, or is that kind of always that somewhat worry is there?
Yeah, I think I've become a much better planner. And so I worry less because I literally have a checklist that I go through before I travel. At this point, like I said, I know people in country, so once I get to wherever I'm going, I have, 5 or 6 people that I could call if anything were to go wrong. For example, like if my flight were delayed, or, I got lost somewhere or whatever. I have those contacts with me. I think the nervousness never goes away. So every time I go to a country that I've never been to before, I get that same kind of nervousness, and it's important to be, I think it's healthy, actually, to be a little nervous and to be on, because once you let your guard down is when things can happen, So I think, being constantly improving on the planning helps with the nervousness, but it's always there because you're in a new place and you're trying to figure out, what's what and who's doing what and what the rules of engagement are in terms of, everything from like the layout of a city to the language to when things are open and closed and what the, norms are for greeting people. And, you're trying to remember not to drink the tap water, not to rinse your mouth with the tap water from the sink. I mean, there's a lot of stuff to remember when we're in other countries, and a lot of details to remember. And so I think some of my nervousness comes from that, from, having a lot to remember.
Okay, and then the last big F is funding. We can go into a whole entire different webinar talking about different creative ways to fund a trip abroad. However, the best thing that we can leave you with is letting you know that there is a lot of money out there through scholarships that you can apply for. The steps here listed is a good method for you to follow in order to make the process easier and more efficient for yourself. We put this together by looking kind of at a funder's lens. So talking about your story, what do you need, your motivations, your skills. Think about the global health competencies that we touched on in the first webinar and how you demonstrate those. Why should somebody give you a scholarship and invest in you, and all of that ties into your story. And then creating a budget, so figuring out your specific use for all of the funding you receive, and we're talking down to like food and flights and hotels, keeping all that in mind to show that you really have thought about how much money you need, and it provides a more realistic lens as well for your funder. And then what else are you doing to build your funding? So what are you contributing as well? And then also keeping track of your impact. So being able to create concrete goals and checkpoints for yourself and for your funder to kind of keep track that you are meeting the goals and what you set out to do. And then, yeah, so we're going to pass it on to Josie now, and any additional comments she has about the barrier of funding.
Well, I think definitely what you said about finding scholarships and funding. Again, I would just say your schools are a huge, your teachers. I've known people who have done like partial, who get their interning organization to to give them the flight and the meals when they're in country, and then they do like a GoFundMe account for, you know, any other expenses, or for living expenses if they're going to be there for a longer amount of time. So it's very rare. It's not impossible, especially if you're going to a private, I would say, a private university. You have a much higher chance of finding like an all-inclusive, all expenses paid, like very good package for funding for doing internship work or traveling abroad or volunteering abroad. The Peace Corps is a great comprehensive funding opportunity. It's a 2-year commitment. And a lot of the scholarships and funding opportunities require some kind of commitment in return, whether it's service or reporting. We had an intern this summer who had to blog, you know, from her internship with us here. And she was able to use some of the funding to travel to Ethiopia, and we funded her. We paid for the flight and the internship funding, the internship scholarship she had, gave her funding for the expenses while in Ethiopia. And so, but in return, she had to produce these 3 blogs and write a report around it. So, and she had to create the budget and all of that. So really being able to share your impact. So now you went on this, you know, 3-month volunteer. What did you get out of it? What did you do while you were there? So that keeping track of the impact is really important, and being able to share that impact with the people who funded you, whether that was your school or your GoFundMe folks or your, you know, your employer, you know, to be able to demonstrate to them how it was impactful and how your work made a difference in the country that you traveled is a huge boon to helping you get more funding later, whether it's from those same people or different people, and also to help you grow your network of people who are in the country. So once you go, you then meet other people who are doing the same kind of work, who then you have their contact information, and they can open doors to future travel and future work abroad.
Okay, so that wraps up our section on barriers. We're going to move now into our Q&A session. Program coordinators out there, please encourage your students to ask questions. Now is the time. We are getting an influx of questions right now, and we're going to try and get through as many of them as we can. We actually just have a really good question from Esteban Pineda. So do you hire people from countries you're trying to aid? Wouldn't it be more effective to hire people who know the country best instead of an American graduate who has been abroad for only a few years?
Yes, and we work with, we wouldn't be able to do our work. I mean, we're all based here, but we wouldn't be able to do the work if we didn't hire people who are based in country and who work there and who are educated there and who, you know, who know their realities best. And that's exactly our model. Our model is we provide the capacity building, so the training, the tools, the theory, the curriculum, to be able to increase the capacity and sharpen the leadership skills of people who are already working in the country and already making a difference on the ground. The reality is that it's very difficult to hire people all around the world. In order to do that, we would need to register in each of the countries. We would need to register as an NGO in each of the countries where we're working, and that's an expensive thing to do. And so we work with, so I manage a program here. I'm one person, but we work with country representatives is what we call them. Sometimes they're called country advisors, for example, in GHFP, technical advisors who are in all of the countries and doing the work. And so we provide the tools and they implement them, and we provide the tools in collaboration with them. So we just don't, I don't sit here and do the curriculum and plan the whole training. I draft it knowing what I know from my work there, and then I send it to them, and then together we come up with a good training curriculum that's going to work in Liberia. And that's going to look different from the training that we just did on the same topic in Ethiopia. So working with people on the ground who are the real experts. I mean, Angela introduced me as an expert in global health, but the real experts are the people, exactly right, Esteban, who live there.
Another question we have, and this should be a fun one, what has been your most eye-opening experience?
I think for me, my most eye-opening experience, well, I have to say, every time I do a site visit, and by site visit I mean when I actually go out. So for example, this picture that you see on the screen right now is from Liberia, and that's what we were doing. We were going to, and one of the ones from before where I'm sitting with a bunch of girls on a bench, is from a site visit that I did in Liberia. And we went to an organization that was doing work with girls. It was actually a shelter. And so girls who had to leave their homes because of violence in their homes and needed a safe place to stay. Most of them were survivors of sexual violence. And that was, I think, the most eye-opening. Every time I talk to young girls, especially, moved me. Just at the level of violence and hardship and difficulty that culturally that they have to contend with in all of the countries where we work, and the fact that, you know, I've met girls at 10 years old who have fled their husband, who have been married at 10, and to just know that about them when I'm talking to them, and just they know their reality and what they know is so different from what I know, and that is constantly, I'm constantly in amazement of that. Just the drastic differences of, you know, my 10-year-old niece and you know, and girls who I've met in Liberia, like the ones in this picture, who just live a very different reality. And so it just keeps me also motivated, and realizing that the work that, for example, in this organization that we went to visit, one of our champions is what we call them, fellows. Our champions was working how important her work is in keeping Binta, who's the girl in the blue polka dots there, keeping Binta away from her husband, and, you know, keeping her safe. I think that's always my most eye-opening.
We have a question from Machi Michael. I worked in the U.S. healthcare system management and as a nurse in India as an early professional career. I can see how my skills can be transferable, but is that visible enough / credible enough for employers? If not, what can I do to improve my profile?
I think it is credible, definitely, and highlighting that and putting that at the very top of the resume, along with, you know, having that be the lead sentence in a resume in your experience is one way to do it. Having that be, working that into, you know, any kind of interview, even if it's a phone interview or an informational interview, is definitely one way to do it. And I think that experience, like I said, nothing speaks like that experience. And so to be able to give concrete examples from drawing from that experience in an interview is invaluable. And that's what we look for. So our interview questions are often, tell us about a time when you had a challenge implementing a program that you had designed, or a design in a program, and being able to draw the example that you talk about in an interview, or even in a letter, a cover letter to a job application, and being able to draw concretely from that experience, I think it would be my advice.
We have another question from all the way in San Diego. Why would you recommend going into global health?
Wow. I think for me, what drew me is that so many of the issues that we encounter here, and I'm speaking from here as in the Bay Area in California, are similar in terms of, so for example, sexual and reproductive health. We work a lot around with young people, with youth leaders who are working to prevent teen pregnancy, for example, or early pregnancy, which is often dangerous for both, the girl, the adolescent girl, and her baby. So the issues are the same, but they look really different in global health. And so for me, I like the challenge of it. I like that it challenges my ability to adapt and change. For me, I liked and got hooked on the learning, the vast learning that I have every day from the people that I work with all over the world. And like I said, the experiences, the vast experiences, how being a girl here looks really, really different in all of the different countries that we work in. And so for me, it was the challenge. And also we're finding, it's funny because we just, I think it was 2014, was the first time I worked domestically. So I had never I was hired at PHI in 2001, and I had never worked in the US in terms of health work. We started a program in Louisiana and Mississippi. And surprisingly to me, a lot of the same issues, for example, around access to health services, pregnancy, access to a safe abortion, for example. It's actually easier to get a safe abortion in Ethiopia than it is in Mississippi. So a lot of the issues the health issues, I apply what I've learned working in Ethiopia to my work in Mississippi now. So I bring it, I think often in global health, especially from this perspective, we think about global health as taking our learnings from here and applying them there. And I work at it the other way, of applying the learnings from the outside of the US to the US, and that's also new and exciting to me. I don't know if I've answered your question. I hope I have.
Okay, and from Ray Spriggs, you mentioned the importance of being bilingual or multilingual. As a global health employer, would you consider hiring someone who doesn't currently speak a second language but wants to learn one or multiple?
For us, and I'll just speak as our program, and when I've hired people, I look for that already. Like, someone has to have studied it extensively and be relatively fluent for us to hire them to do program work. Now, you can do administrative work without being bilingual, but for us, it's a challenge, and we have to work around it. And often I find myself, so even if you're not going directly into service delivery, like if you're not going to be, doing training or providing an actual health service in another country where you would definitely need the other language ability, even doing the administrative or the communications work for another program is it's a huge benefit. And often we have to work, we have to think extra to be like, oh yeah, we can send it to so and so. Oh, but they don't, like, oh, but they don't speak Spanish, so they can do the English piece, but not the Spanish one. We have to find someone else to do that. So it's an invaluable skill. I would say it's part of any good education is getting some kind of understanding of a second language. So I wouldn't hire someone who's just starting out. I would hire someone who at least has a decent ability in the language set that we're looking for. So that might be Hindi, that might be Urdu in Pakistan, or that might be Spanish. But I wouldn't hire someone to do the on-the-ground, in-country work who doesn't at least have some working knowledge of another language, because it really, and there's more and more research to say that, it really allows, being bilingual and knowing another language allows you to think in another language and be sensitive to the way that we express ourselves. So the way that we choose words when we're communicating with people. And so that's why I said, even if you don't speak Spanish or you don't speak, Chichewa in Malawi, even if you don't speak that, the fact that you're bilingual in another language already makes you sensitive and aware of the ways that people express themselves in another language, and it's a matter of cultural competency for me too. I don't know if that makes sense. But.
Okay, and another question. What was your biggest challenge going into global health?
My biggest challenge, I have to say, was not having a background in global health. I didn't have a health background. Like I told you, I majored in literature, which has nothing to do with this. What I learned, I started off as a program assistant in global health. So I learned it from the ground up. So I started off, doing a lot of the logistics and the planning meetings for people and arranging focus groups and arranging interviews to select our participants, for example. So my strength was communication, my bilingualism, my knowledge of, started off working in Central America, so having the cultural competency piece that I keep mentioning, having that was a real strength. What I lacked was the actual knowledge around the terminology of, how do you say family planning in Spanish? I don't know. What are the issues around maternal mortality? What are the issues around, the best, how do you decide the best family planning methods depending on your age, your relationship status, like all of that technical knowledge was what I was missing, and that was my biggest challenge. And I had to learn that little by little, just by reading myself. So as I was sitting there making binders for people's trainings, I actually read the articles and learned a lot about global health, about sexual and reproductive health specifically, around the issues involved in that. And so I think that's a huge challenge, is keeping up on all of that and learning that kind of on my own was a challenge. Now I really appreciate that, and have often, about 8 years ago, I talked to someone about potentially going back and getting a master's in public health or something, because I felt like, oh, I'm not really a health person. Like, here I am doing this work, and I I must not really know what I'm doing. And she said, what are you talking about? Like, why would you go, why would you say that? You're already doing the work. Most people get a master's in order to do the work, but you're already doing it. So, and you already know this stuff. And I said, well, but I need the theory, and I need to know about epidemiology, and I need to know these things. And she said, do you? How, aren't you doing the work without that? So, so really just valuing, you get the education, you get the knowledge in all kinds of ways, I would say, and that was a big challenge for me, is getting the technical expertise outside of a university.
And then our last question from Amy Lee. Could you please talk about global health opportunities for upcoming college graduates that doesn't need like a master's degree or 5+ years experiences?
So people who are about to graduate from undergrad. So I would say, taking advantage of that last year and that first year outside of your undergraduate degree to really have the networks and have made the contacts to be able to do some of the interning and volunteering and the traveling. If you haven't already done that, or in your undergraduate degree, in your undergraduate career, would be an ideal time to do that. So leaving your undergraduate degree with the great letters of recommendation and great contacts for whatever your next step is really good. And having the time and the space right after you leave undergraduate and applying for jobs to be able to say, I'm gonna take a job. Look, for example, I'll give myself as an example again. My first entry here was as a program assistant, so I wasn't doing the type of work that required the 5+ years of experience that I am now. But it gave me an entry into the work that I was able to build on organically. So even though I wasn't doing the program planning, I was putting together the binders and making the phone calls and sending the emails to get people to the training. But I got to go to the training because I had to help with the logistics of it, and I got to meet the leaders that we were working with, and that was a huge eye-opening experience. And that gave me a contact with people in other countries, and that helped me build my network. So even if the job that you're going to get is a very entry-level position, doing more administrative work, or doing an internship role or research assistant role that isn't, that is more entry-level, it still can be a huge stepping stone to your career and getting you the network and the contacts that you need in order to build your career moving forward.
Okay, so that was our last question. Just one big thank you to Josie for answering all these amazing questions. Thank you to our participants as well. Just to conclude, this will be posted on our YouTube page. Please participate in our survey that you will receive after this, so we know if you enjoyed the webinar, if it was helpful for you. And also, please join us for our next webinar on January 19th, where we're going to be talking about your career options. Shout out to all the FACES students that participated today, and we really hope you got something out of this. For more information, please look at our website, follow us on all our social media platforms for more information. Another thank you again to Josie.
And definitely if you're interested in learning more about my work specifically, or if you have any follow-up questions, I'm happy to answer. And you can look me up at riseuptogether.org. So riseuptogether.org, and it might take you 2 or 3 emails to get a response from me, but I will respond, I promise. So thank you.
Thank you again, everybody. Bye. See you
Bye.
next time.